I'm Russ McLean, Chairman of the Patient Voices Group, and today I'm in conversation with Mr. Kevin McGEE, Chief Executive of East Lancashire Hospitals Trust. Hello, Kevin.
Good afternoon, Russ.
Well, let me begin first of all by congratulating you on your recent marriage and wish you and your wife well for the future.
Thank you, I appreciate that, and we had a wonderful wedding and honeymoon, so looking forward to our future life together.
Now, whilst you're away, you've had some guest bloggers, in fact board members, filling in for you on your weekly blog, and it was a sad day indeed when one of your guest bloggers, Martin Hodgson, who's your Director of Service Development, reported to us that the A&E department at Blackburn was the worst performing A&E in the country. How did this happen, given that you and I talk on a regular basis of how you're making improvements in those A&E figures?
So that was taken out of context. We have been struggling, which I've said on a number of occasions in terms of A&E performance, but it was one particular measure taken on one particular day, and if you take it over a wide range of days over a period of time, we certainly haven't been the worst in the country. And indeed, I'm delighted to say over the last month our performance has been excellent. Indeed, last week in particular, we were one of the top performing countries on A&E in the whole of the country. So we've still got a lot of work to do on our A&E performance. We take it day by day. I'm still worried about winter and capacity and the number of patients that we will be seeing during winter. But we'll take each day as it comes, and at this point we're in a good place in our A&E performance, and I'm absolutely delighted with the work that the staff are doing and the effort and the work that they put in.
That's great news. Now, the STPs, or Sustainability and Transformation Plans, are national initiatives, and East Lancs Hospital Trust are part of the Lancashire and South Cumbria STP, and this is made up of 5 local delivery plans that feed into the bigger STP, and they require that local health and social care systems deliver services in a more joined-up way. Now, ELHT have recently established an innovative collaboration with some local GPs to jointly run GP practices which reach across East Lancashire. There's a lot of work taking place to ensure that you can safely and effectively start providing these services from November. Is that something that's on track?
It is something that's on track, and this is something. This is led by GPs and primary care, but we're providing support and backup to them. Clearly, we're a large organisation. We've got a lot of services, corporate services, backup services that we can help support GPs with. So we see ourselves in the future working very much in collaboration with primary care, very much supporting primary care, but primary care we would hope would always be led, and it's the right way, by GPs, with organisations such as myself supporting and backing them up.
Do you see that as something that's going to be happening across the country, with more trusts and secondary care becoming more involved in primary care?
I think you are seeing this everywhere in the country. So if you think about the health service, from a patient's perspective, is there a difference between the hospitals, between GPs, between community services? There shouldn't really. People just want to access high quality, seamless services. And I think for far too long we've had too many breaks between the different bits of the NHS. So what we're seeing, and one of the things with the sustainability and transformation plans, is trying to bring services together so that they work in a much more joined up way, and we haven't got the breaks in service that you see currently.
Now, a few weeks ago you had a Professor Brian Dolan visit the Trust, and Professor Dolan is the driving force behind the national campaign to end PJ paralysis, which supports patients getting out of bed, dressed and mobile as soon as they can. The view is that people feel better when they're dressed and moving about. They feel less vulnerable, of course. Could you tell me a little bit more? Can you explain a bit more about this?
So one of the things that I think we've recognised both within this organisation but in the NHS generally is that when people come into hospitals, particularly big hospitals, they can almost become institutionalised, and a lot of the sort of freedoms and things that they would take for granted at home are taken away from them. So what we're trying to do is to make things more normal for patients, and one of the things is getting dressed. So, if patients don't need to be in beds all day and they can sit up and they can sit out and they can walk about, we're having a real emphasis to get patients dressed, and there is a lot of really good evidence that shows, the more normality you can bring to a patient's daily routine, even if they're in hospital, it has significant and beneficial clinical effects.
And are you seeing returns from that?
I think so. So one of the things we're seeing is the feedback from the patients themselves and their families is much more positive. And patients, clearly, if they're feeling better about it and they're feeling better about being up and about, their recovery will be quicker and better.
Mr. Jonathan Wood, your Director of Finance, recently reported that approvals for Phase 8 are almost complete and that your newly completed East Lancashire Elective Surgery Centre will be officially open soon. There'll be a new chemotherapy suite, a major ophthalmology unit and new outpatients department are all planned. When can we as patients expect to see these services coming online?
So we've been doing a lot of work in terms of the capital build, particularly on the Burnley site, and there's some areas of development you'll see coming on stream in the next few weeks. So the new work that we're doing on elective inpatients and elective day cases, that new unit will be open within the next few weeks. In fact, patients are already starting to go through there, but it will be fully open in the next few weeks. The work that we're doing in terms of outpatients and chemotherapy, the chemotherapy is coming online in the next few months. The big work that we're doing on outpatient will take a bit longer. I mean, that is it's a 16 to 18 million pound development. So it'll be tidying up all our outpatient facilities. It'll put new theatre capacity onto the site. So that will be a programme over the next 2 years. So starting now with, if you like, the work that we're doing on the day case facility, working all the way through with chemotherapy, working through then to the new outpatients and theatres. It's a capital programme of many millions that will run for the next couple of years. What we're also looking to do, and I think I have talked about this previously, and we've not got it completely bottomed yet, but we're working in really great collaboration with the University of Central Lancashire. They've got a campus in Burnley, and what we're looking to do is to develop accommodation on the Burnley site for doctors and nurses and for medical students and for nursing students who will come through the organisation, and put new accommodation on site for them to be based in. So, we have really big expectations and really big plans for the Burnley site over the next couple of years, and you will see a lot of capital and new build going into the site.
And of course, it follows, presumably, if you're taking a lot of work from Blackburn to Burnley, that will give you a better place to be with services here at Blackburn. So you'll be able to deliver, hopefully, better urgent care services here and better A&E services here.
No, absolutely. We know the Blackburn site is under a lot of pressure. There's a lot of emergency patients coming through the organisation, and again we've talked about it previously, but the A&E department in Blackburn is the busiest department in the whole of the Northwest. The take it has is huge, so it's really important that we've got capacity to deal with the number of patients that are coming on this site. So the more that we can take planned work and planned activity and have that on the Burnley site, it means we can ring fence that work, that activity. Patients are not getting appointments cancelled, and we can then have the capacity and capability on the Blackburn site to see all our emergency.
Are patients not turning up for appointments and not making appointments and not keeping their appointments? Is that something that's still a huge problem for the Trust? I
wouldn't say it's a huge problem. We still do get instances where, for various reasons, patients don't turn up, mainly for outpatients. Occasionally it's for day case activity as well, but it's primarily for outpatients. And clearly every slot that's not taken is a slot that's then wasted that somebody else could have. So clearly we would like everybody to turn up for their appointments when those appointments are given. And we do a lot of work such as text reminders and phone reminders and postal reminders. It's not a big problem, so I wouldn't want to make it out to be worse than it is. But it is something that we can improve on and we should improve on.
So in addition to all the things we've talked about at the new Burnley site, there is also going to be a new children's outpatients department. When is that due to come online?
So again, that's part of the plans over the next couple of years. If you think about the Burnley site, we've got some great facilities. So the Urgent Care Centre, the Women's and Children's Centre, but there's also some quite old buildings. And what we're trying to do is to get rid of all of the old buildings, knock them all down, streamline the site so that it becomes much more easier for people to navigate around, because one of the things about the Burnley site I find it's quite complicated with the different levels. So the work that we're doing in terms of the outpatients, in terms of the new phase 8, will make it much simpler for people to walk through and flow through the organisation. So the children's outpatient development is part of the work that's going on over the next 2 years.
Now, you and I haven't met for a period of time, owing to one thing and another, but I've seen in the press that you've got permission to build a new car park. Is that right?
So we are working on car park development. So we're doing that in conjunction with sort of, the local authority colleagues. I haven't got all the details behind it, but we are working with our local government colleagues, and there will be more car parking facilities either on the Blackburn site or very close to the Blackburn site.
And of course that's going to cut down significantly on the problems that people have accessing the site from the road.
Absolutely. So one of the issues that we have is we do have, at this point, we do have limited car parking spaces on site. Particular times in the week and particular times in the day, particularly early afternoon when people are trying to access the site for outpatient appointments, there can be queues that are forming. New car parks on the boundaries of the current sites and car parks will give us the capacity for people to come in and out much quicker.
Every year across the country, hundreds of patients give up their time to get involved with the patient-led assessments of the care environment, and this is a national directive from the Department of Health and NHS England, and this year there's been a marked improvement in the domains looked at in these assessments here at East Lancs Hospital Trust, so that must be brilliant news for you.
It certainly is. One of the things I'm really conscious of is that we need to involve our communities in all of the work that we do within the trust, and one way that local people can get involved is through these place assessments. And I think they're really important because they are an independent view of what our communities are saying about their local hospitals in terms of cleanliness, in terms of whether they're dementia friendly, in terms of the quality of the food. And I think it's really important we listen to what people are saying. So in previous years we've done reasonably well in the place settings, but this year we've done even better, and I am really delighted that all of the scores have improved over previous years.
Well, I should tell everyone that they have improved dramatically. Your food rating rose to 81% from 77%. You've had increases in the disability domains and dementia-friendly domains. How important is it to you as a chief executive? You've said that it is important to involve patients, but how important is the place assessment per se?
I think the place assessment's absolutely vital, because if you think what people are rating, it's food, it's dementia friendly, it's condition, it's appearance, and I think it's really important. These are not my hospitals, my services, they're the local community services, and it's really important that the local community get involved in their local hospitals and their local services and feedback what they think, good and bad, because it's only by having that interaction will we get improvements in services. And I think one of the things that perhaps the organisation lost going back a number of years was that connection to its local communities. And I'm hoping with the work that we're doing and the support from the likes of yourself, Russ, and other groups, that we can make sure that connection is never lost.
On a very dark day in its history in 2013, the Trust was placed into special measures, but since that time there's been a dramatic overall improvement, and the Trust is now rated as good by the regulator, the Care Quality Commission. And you've gone on record as saying that this significant improvement has been achieved by a successful partnership between the board and the staff of the Trust, as together they continue to focus on improvements. And in a dramatic turnaround, we heard yesterday that you've been commissioned by NHS Improvement to work with the North Lincolnshire and Goole Hospitals Foundation Trust to improve them. How's that going to work? What in fact are you going to be doing?
So North Lincolnshire and Gould have been placed back into special measures, and they're in special measures both for finances and also for the quality of services. So this is an organisation that's got a number of things it needs to deal with. I've visited there on a couple of occasions, and what I see in that organisation, in spite of the special measures, are great staff trying to do the right thing day in, day out. Now, as you said, we went through a very dark period going back a number of years, and because of the work that our staff, we've come out of that, and we are rated as being good. That's not good enough yet. We're looking to get to outstanding, and that's the next piece of the journey that we're on. Now, I think we can help North Lincolnshire and Goole by the experience that we've been through, by the experiences that we've had, and the ability that's been gained by staff from the work that we've done. I think we can really help North Lincolnshire and Goole by sharing the work that we've done, the improvement journey. But I also think we'll get something back from it. I think, my staff will gain experience of another organisation, and they can bring some of the good practices that go on in North Lincolnshire and Goole back into East Lancashire, as well as sharing our good practices, and that will help us then on our journey from good to outstanding. So yes, it will require some time and effort from people, staff in East Lancashire, but we're going to plan it appropriately. It will make sure it does not impact in any way negatively on what goes on within East Lancashire. And as I say, my expectation is that we will gain from it, because we will pick up the good practices that go on elsewhere.
In your experience, as it is in mine, do you think that where a hospital has been placed in special measures, that we talked about it a moment ago, there has been a disconnect between the trust, the hospital, and the community itself? Do you think that's really important?
I think it's key. I think it's, you can see that. My experience of all organisations, all hospitals that have lost their way, if I can put it that way, is one of the key things you can see is there's a lack of harmony between the local communities, the patients that the hospitals serve, and it's not a good place to be. I think it's really important that local people are proud of their local hospitals, proud of their local services, think they can influence what goes on within the organisation and can directly influence and change what goes on in their local hospitals. I think when you look at North Lincolnshire and Goole, you can see that disconnect, and one of the things that hopefully we can help them with is how we work with, how we've worked in a different way over the last few years with patients, with our communities, to try and get that connection back.
Isn't trust a big thing? Because without that, there isn't much else. So if you don't have the trust between the board, the staff, the patient, you're on a journey to nowhere, really.
I think that's absolutely right. And, one of the things I'm really conscious of in terms of healthcare is I don't think there's any healthcare organisation or system anywhere in the world can claim they get everything right every day on every occasion. The nature of how healthcare works is you're always making judgments and calls, and occasionally something will go wrong. But what you have to do in that situation is be open about it, be honest about it, and try and learn from it. And, I'll be the first to admit that we don't get everything right in East Lancashire. We try and get things as right as we possibly can, but occasionally things will go wrong. But what my hope is, my expectation is we are developing and have developed a culture and building on that culture whereby if something goes wrong, we recognise it, we learn from it, we hold our hands up, and we try and move on quickly.
Will you be personally involved in this process with the other trust?
I will. It'll involve myself, it'll involve some of my executive directors, but really what I want to do is to give staff at different levels in the organisation the ability to experience this work and to gain from this work, because it'll be great for them. I think they'll gain an awful lot from it, and as I said, they will bring good practice and good experience then back into East Lancashire.
Is there a danger that you might spread yourselves as a trust too thin?
So I think we have to be careful of that. That's absolutely something that we are aware of. First and foremost, my responsibility and the responsibility of our staff is to the people of East Lancashire, and we will always focus on that, and that will be our number one priority. But if we can help another organisation through our past experience and some of the things that we've picked up, then I think it's only right that we should do so.
Much is said about winter pressures in the health service, when the reality that I know is that the pressures are constant and not seasonal. As we head into the winter months, there will be the usual rise in respiratory illness and injuries due to slips, trips and falls. But what can the public do, Kevin, to help the hospital and its staff during this busy winter period?
I mean, you're absolutely right, Russ, to say that the pressures are all the year round, and that's what we now see. There will be an increase even on what would be normal going into the winter. You mentioned respiratory and trips, slips and falls, and that will occur. I mean, I think what's absolutely key here, and there's a lot of publicity going out on this and has gone out in previous years, but people should only attend A&E if it's absolutely necessary. I can understand, people's frustration if they can't access services elsewhere, but A&E is really for people who need A&E. We've got minor injuries units, we've got walk-in centres, there's pharmacists, there's GP services. People should think of all the different routes they can access, 111 being a really good example. People should only really come to A&E if it's necessary. And that will help not just them, but it will help other people as well, so we can save A&E for the people who really need it, and we don't get the long queues building up. So I think it comes back to this partnership thing. It's people using the services wisely. Of course, if anybody needs our services, they should always try and access it. But we still do get, and in spite of the publicity and everything else that goes out around it, we still do get people turning up wanting to access A&E services with very, very, very minor illnesses that could be managed and cared for elsewhere.
But surely that's around educating patients, isn't it? And that's not something that, well, although the hospital does, that's something that central government, the Department of Health, should be pushing.
Yeah, I think it's one of those things where we've all got a responsibility. So we know that we have a responsibility to educate patients and families about what our services are for. But it's not just us, it comes through like central government, it comes through the clinical commissioning groups. Everybody has to take that responsibility, not just the hospital.
I think you mentioned before, if in doubt, ring 111 and they will hopefully signpost you to the correct service.
That's absolutely right. And sometimes people may not even need to go through 111. You can go direct to your pharmacist, or you can go through to your GPs. I think there are different routes, and it's just being sensible. Clearly if somebody is incredibly worried about something, then 111 and 111 can advise the appropriate route. Just be sensible.
In my day, Kevin, it would have been ask your gran.
In my case, it still is now.
Will the Trust be maintaining its great record on staff immunisations? So this comes off the back that you've had particularly high take-up of immunisations, particularly the flu jab I'm thinking of, across the years. And how do you as CEO encourage your staff to have that immunisation?
Yeah, you're right. The last 2 or 3 years we've been in the top 2 or 3 in the country in terms of the number of staff who've received immunisation. I think it all comes back to staff engagement. If you look at our staff engagement over the last 3 years, we've been one of the best trusts in the country on the staff satisfaction survey. And it's because of the work that we try and do to involve staff in all decisions and try and support staff in everything that we do. I think if you have that staff engagement, it becomes much easier then to get staffing involved in things such as the flu campaign and vaccination. We have a really active team that go out to all the different staff groups. If you think, we have over 8,000 staff, many different locations, so we can't wait for staff to come to us. We have a very, very active flu vaccination team, and they go out to all the different locations that we provide services in. They see all the various members of staff, and they encourage as many staff as possible to get vaccinated. And there's also a little bit of a competitive element in this. We've done so well in the last few years. It's been 80% plus. I want us to get to 85% of staff this year who are vaccinated, and again then be one of the best in the country.
Well, good luck with that. I'd like to finish on engagement because your annual general meeting is looming. And for the past couple of years you've been in Burnley. You've changed location this year. I think we better start perhaps by telling everyone when your annual general meeting is.
So our annual general meeting is on the 20th of September. It's in the cathedral in the centre of Blackburn, and it runs from sort of 2 o'clock onwards into the sort of the late afternoon. So there'll be lots of different stalls where people can access lots of different stalls, get blood pressure taken, they can talk to staff about what they do and how they do, and that then goes into our AGM, which is later in the afternoon. It won't run into the evening. We're looking to be finished by late afternoon, and hopefully it'll be a great occasion. It's a way that patients can engage with staff. It's a way that patients can engage with the board. I do a presentation every year about what's gone well, what do we need to think about for the future year, and there's an open forum for questions and answers.
And I think, from my perspective, obviously I've attended for the last couple of years, that it's a great way for the Trust to showcase some of the innovative stuff that's actually going on at the hospital that really you wouldn't know about unless you go to the AGM.
No, I think that's a thing about about the work that we do in East Lancashire. We don't really shout about it as much as we should do. And some of the things and some of the services that we provide, I think, are as good as anything you'll get anywhere in the country. And we do need to make more of a fuss of it.
Well, let's hope we can both do that at the AGM. Kevin, thank you very much for taking the time to talk to me.
Thank you, Russ.
Please remember, if you have a question for Kevin McGee, you can contact me at the address at the end of this presentation, but do remember that we can't deal with individual complaints in this forum.